When you think of hip surgery, you probably think of older people, but hip pain is not all that uncommon among young adults who participate in sports or other activities. The good news is there's a procedure that can dramatically reduce the recovery time. Dr. Maria Simbra reports.
High school special ed teacher Jennifer Schuster lives an active life.
For my job, I have to walk to all my classes, and I used to run every day. I'd run anywhere from like 4 to 7 miles a day.
Then hip pain stopped her in her tracks.
I started walking with a limp. It would come and go, and that's why I thought, well, maybe it's arthritis.
But it was actually a torn labrum. The labrum is a ring of cartilage along the outer rim of the socket part of the hip joint. It holds the ball at the top of your thigh bone in place. It can get torn from the wear and tear of vigorous activity.
Typically, we see structural problems of bone that may be created by sports in our youth that leave our hips shaped not perfectly round.
For young patients like Jennifer, opening up the hip would mean a more difficult recovery.
They're like using these walkers, and it's usually older people, and you're like, oh man, and you're out of commission for such a long time, and I can't afford to be out of commission like that.
For people younger than 50, a better option is arthroscopic surgery. This has a long history of success with other joints. Doctors can put in cameras and instruments through incisions no wider than your pinky to fix the tear and reshape the bone.
Not only once you do these surgeries can patients feel better, but they get back to a very active life. I think she surprised us all with how well she did.
As soon as I woke up from surgery, he had me sitting on a stationary bike that I had to ride for 20 minutes.
We find that by the next morning, the majority of the pain is gone from the operation.
There is still a lot of rehab afterwards, no weight bearing for at least 2 weeks. Then, to prevent scar tissue, a strap-on machine at home passively flexes and extends the leg for 8 hours a day, plus physical therapy for 3 months.
I was non-weight bearing for 6 weeks. He told me, I don't want you running for a year.
A risk which occurs in less than 1% is a blood clot in the leg that can travel to the lung. This is potentially deadly. The operation is not for people over 300 pounds or for people with sedentary habits. Insurance usually won't cover it for people older than 50. Jennifer's biggest concern before the procedure?
Well, if I have the surgery, am I still going to be able to run and ride my bike and do everything I like to do?
She had the surgery 3 years ago. Now she's back to all her usual activities, so much so she hurt her knee skiing.
I have great flexibility. I have great movement.
I'm Dr. Maria Simbra, KDKA TV News.